March. Now, the conservative advocacy group Heritage Action for America has panned the Republicans' health care proposal, releasing a statement which says, in part, in many ways, the House Republican proposal released last night not only accepts the flawed progressive premises of Obamacare, but expands upon them. We heard Health and Human Services Secretary Tom Price respond to this criticism.
I think that this is the beginning of the process, and we look forward to working with them and others to make certain that, again, we come up with that process that aligns with the principles that we've defined, that they actually adhere to or agree with as well, and that is that we need a system that's affordable for folks, a system that's accessible for individuals, that's of the highest quality, that incentivizes innovation, and that empowers patients.
With me now is the CEO of Heritage Action for America, Michael Needham. Now, I want to talk about the substance of the bill and, of course, just the Republican politics. Let's start with the substance. In your statement, you said there's no significant difference between this effort and Obamacare. Is that really fair?
Well, I'm not sure if that's exactly how we said it, but ultimately the way you start a process matters, and they're starting this process with the basic architecture of Obamacare in place. They keep much of the regulatory regime that Obamacare put into place. They keep the bias in the tax code towards employer-sponsored health care, and they replace the Obamacare subsidies with different subsidies, which actually go to many Americans who are even wealthier than were eligible under Obamacare. And so the problem is the progressive mindset looks at health care and says the federal government, your insurance company, and your boss should be the critical players in health care. That's the kind of architecture that this bill keeps in place, while what conservatives want to do and what we need to repeal Obamacare with and replace it down a different path is to make this a free market-based healthcare system where it's really the individual and his or her doctor who's making healthcare decisions.
Okay, so on that note, President Trump tweeted, not surprisingly, he said this: "Don't worry, getting rid of state lines," to which I think was part of what you're referring, which will promote competition, will be in phase 2 and 3 of the healthcare rollout. And you heard that from Secretary Price as well.
Right.
So does that give you comfort?
Well, it doesn't, because again, when you're building a house, the foundation matters. And the foundation that they're starting on keeps this kind of progressive mindset in terms of what some of those regulations are, in terms of how you're subsidizing people getting care, and really not making sure that you're getting at the linking of insurance and your employment. Ultimately, when you look at phase 2, as they're describing it, some of the stuff that HHS Secretary Tom Price can do, that's all stuff that can be rolled back by a future administration. When you look at phase 3, why would any Democrat sign on to a phase 3 if it's getting at that progressive architecture of Obamacare? That's what has to be done on reconciliation. That has to be done with 51 Republican votes. Repeal Obamacare, deliver on that promise that you've been making ever since 2010, and then once you've done it, let's have a big national debate about how we can make a healthcare system that serves our fellow citizens better.
I just want to ask sort of a philosophical and political approach question, which is, what you just said made perfect sense when you were trying to set the parameters of the debate for conservatives when they were in the minority and didn't have the White House. Now you have the White House, you have a majority in the House, you have a majority in the Senate, which means you actually have to govern and legislate, and you're limited by the number of seats and votes that you have.
Yep.
Given that reality, do you understand why they are doing what they're doing to try to cobble together as much of a change as they can to fit the philosophical ideas that you just pointed out?
Well, I just think they're going about it the wrong way. So we have a successful model in 1997 when one of the great conservative victories, welfare reform, was done on reconciliation. An entire federal welfare program was repealed on reconciliation and replaced. That's what we need to be doing here. Let's repeal Obamacare, let's take away that progressive architecture, and then let's rebuild it with something that's stronger and serves the American people better.
One final quick question. I know your organization doesn't engage in Republican primaries, but for Republicans who support this bill, do you think that they run the risk of being primaried from the right?
Well, I think we're in a moment right now where every Republican wants to get to yes. We want to get to a plan where we can repeal Obamacare and replace it. In order to get to yes, you're going to have to be able to explain it to your constituents. And what we're hearing across the country, I think some of the questions that you're seeing are a lot of voters saying, this doesn't really look like it's going to pass muster.
Thank you so much for your time.
Thanks for having me.
Appreciate it. And moments from now, Senator Rand Paul will speak live to reporters along with several other Republican lawmakers who are criticizing their party's health care plan along the lines of what you just heard here. Republicans reacting to President Trump's claims also of wiretapping at Trump Tower. All that ahead.